Should I be worried about my recession? Hey guys, Dr. Stryker here from Lincoln Crossing Dental Care. This is a question I get asked almost on a daily basis because we're seeing more and more of this. And that's people are having recession around their tooth roots. And number one cause of recession is toothbrush abrasion, meaning we are usually using a hard bristle toothbrush, scrubbing it way too hard on the gums, and over time that actually causes the gums to recede. Especially we see this as people have had orthodontics, especially when they were younger. They've had teeth move through the bone and maybe they don't have a lot of bone over their roots anymore. They might have gum tissue there until you scrub it off though. So I'm seeing this more and more and more. To answer the question though, should I be worried about it? Yes and no. Basically what recession happens, like I said, is when there's no bone over the front of the tooth and you start to lose tissue and you start seeing your root more. Now, the problem with that is our roots are not meant to be exposed in our mouth. So you're going to have a little bit more sensitivity. But the biggest thing is that root is way more at risk of developing issues like cavities than your regular tooth and enamel is. Enamel is like our armor. It protects our teeth, it makes them nice and strong, and it's resilient. It's meant to do the chewing. It's meant to have acid put on it through our food and diet and bases and all kinds of, and go through hot and cold. It's meant to do all these things. The roots are not. And so the problem we see is people who have recession is they're going to get called root decay, which is cavities that are on the roots. And once that process starts, it really is jeopardizing that tooth long term. We tend to see way more issues with these teeth. These are very hard fillings to do and be successful long term. So they're usually having to be replaced constantly. It's irritating the tissue once a filling's put there. We see more nerve problems with these kinds of teeth. So a little recession, yeah, maybe initially that's not going to be a huge deal, but that recession is going to get worse over your lifetime. Might not be 3 months, may not be 3 years, but over the next 5, 10, 15 years, that recession is going to get worse. And that's going to put that tooth way more at risk of developing issues. So should you be worried about your recession? I would start thinking about some ways, if it's possible, to fix the recession if you have it. That's the best answer that I can give you. Now, no one's going to die from recession. No one's going to lose all their teeth because of recession. But having a recession on a tooth does put the tooth more at risk throughout the rest of your lifetime. And that recession is only going to get worse. We do have new ways to fix recession, ways that don't require taking tissue from other parts of the mouth. So that the techniques and technology has gotten a little bit better and has been, tissue grafting has always had a really kind of a bad rap and for being uncomfortable. I know my sister went through it when she was younger because of braces, and yeah, it's not the most pleasant thing. So the technique has improved though. By using tissue from other places, it just makes it a little bit easier. We can get really nice aesthetic long-term results. So it's something I would, have that if you have recession, have that conversation with your dentist, whether they know how to do it, or that conversation with a periodontist, whether they can help you, because it is something that you should start thinking about getting a solution for. Like I said, it's not an overnight emergency, but it's something, if it is in my own mouth, I would want to try and restore that for sure if I could. Thanks guys, I hope this is helpful.